As occupational therapists, we would like you to know more about your sensory system and how it impacts on your everyday occupations such as self-care, learning and leisure. Sensory processing is how our brain makes sense of the information received from our senses. Information comes in through each of our senses. It travels to our brain so we can process it. Then our brain tells our body how to react to that information. For example, when we hear a fire alarm, we process that as a risk and know we should leave the building. The main job of the brain is to keep us safe. We can only learn if our brain decides we are safe and comfortable in our learning environment. If there was a wasp in the classroom, your brain would be hearing and seeing it, and most of the class would be distracted due to fear of being stung. However, some people with no previous experience of a sting may not interpret it as a danger. You will already know that you have 5 senses bringing information from your environment through hearing, smelling, tasting, touching, and seeing. But there are more. There are actually 8 sensory systems, the Super 8. The other 3 systems get information from your own body, and your brain tells you how to react. These systems have fancy names: Proprioception, Vestibular, and Interoception. We will learn more about these systems later. The auditory system is your sense of hearing. When a sound is processed, you will react to it. It may be an instruction given to you by your teacher or your favourite song playing, which makes you get up and dance. Your sensory system should also be able to ignore the sounds of a ticking clock, the hum of a projector, or traffic noise outside the window, and other noises that are not important. The visual system is your sense of sight. When a sight is processed, you will react to it. It may be seeing a bus coming towards you, so you don't cross the road until it has passed. When you are given a worksheet, you read it and respond. Your sensory system should be able to ignore other visual stimulus, such as pictures on the wall and traffic outside of the window. The olfactory system is your sense of smell. When a smell is processed, you may react to it. It may be the smell of toast or chips, which makes you want to eat them. It might be a smell that triggers a fond memory, or it may be an unpleasant smell that makes you want to leave a room. Our smell system keeps us safe, as we wouldn't eat food that smelled off, or we wouldn't stay in a room if we could smell gas or burning. The gustatory system is your sense of taste. When a taste is processed, you will decide whether you like it or not, and will determine if you eat it or not. You may prefer sweet things to sour, or you may like salty food rather than bland food. Eating also involves processing temperature, texture, and resistance of chewing. The tactile system is your sense of touch. This is not just from your hands, but from the skin all over your body. Information about light touch, tickle, discrimination, texture, external temperature, and pain are processed through this system. Your tactile system will recognize if an insect lands on your arm, and you will probably flick it off. This system recognizes if an item of clothing is uncomfortable or an object is digging into you. The proprioception system is your sense of body position awareness. The information comes from muscles and joints, which is processed to tell us our body position and how much force we are using to carry out a task. If we want to drink from a bottle, we need to judge where the bottle is in relation to our hand, so we can reach it, and we need to judge how much force is required to pick it up without squeezing too hard or lifting too fast. The vestibular system is your sense of balance. The information is used to know when you are moving and whether you are upright or leaning over. Some of us like more movement than others. Some people like spinning on roundabouts or fast fair rides, while others don't like these at all. This is mainly due to the vestibular system. The interoception system is the information from your organs, including recognizing when your bladder is full and you need to go to the toilet, or when you have a headache. It is also the sensory system that helps us recognize our emotional state. For example, a racing pulse and fluttery tummy may show you are anxious, or feeling hot and tight may indicate you are getting angry. Take a minute or two to think about all the sensory information happening in your environment right now. Think about what you can see, hear, smell, taste, touch, and how your body feels. You may have noticed the temperature of the room, the noise of a radiator, patterns on the wall, traffic outside, how hard or soft the chair is, or how comfortable your clothes are. There is always too much information for us to process, so we rely on a filtering system to sort out what is important to process, and we ignore the rest. This is subconscious and we have no control over it. Sometimes the wrong information gets in and we miss the information we should be getting. We achieve the just right feeling if our filtering system is working well. We process the necessary information for the task we are doing, and we are not distracted by the rest of the environment. Sometimes we consciously change our environment to help us. We might face our desk to the wall to reduce visual distraction, or switch off the TV to help us concentrate. You might switch on your music or spray perfume to increase your level of alertness in order to carry out a task. You might have a cold drink or eat something crunchy to help concentrate. You might dim the lights or control your breathing if your brain is too busy. If we are trying to process too much sensory information, we may well feel overwhelmed, unable to pay attention, struggle to sit still. You may want to leave the environment, want to retreat or hide. You may feel like your head is ready to explode. The opposite of this is when not enough sensory information is available to process, and you may feel fidgety, unable to pay attention, or feel really sleepy. You may zone out in class, you might not be able to get started on a task, or miss important instructions. Now we will think about how we can get the just right feeling in order to carry out a task. Lots of people use music, chewing, and drinking water as ways to control their alertness. Movement is also a really good thing to use to feel just right. This could be a walk around the garden, chair push-ups, 10-star jumps, or an exercise program. Going up and down stairs, stretching and touching your toes, or spinning round can all help too. Deep pressure, squeezing, carrying heavy objects, squashing into tight spaces, carrying out a heavy work job like moving furniture or pushing a wheelbarrow or rocking or swinging can have a calming effect if we are feeling overwhelmed. You will already be doing things that help you to concentrate, and hopefully you understand why they help from what you have just learned. Now think about some of the things that are tricky for you and think about some sensory ideas to try. This problem-solving tool might help you think about the sensory systems involved in everyday tasks. Think about something that is tricky and put it in the top section of the triangle. Now try to think what part each of the sensory systems play in this activity, and then record them in the middle section. Now, in the bottom of the triangle, think of some strategies that might help. You may want to complete this checklist, which you can find on our website, which will help you work out what sensory systems are making things tricky for you. Once you have completed the checklist, count up the ticks in the true column for each sense and transfer this onto the bar chart for each section. If you have any tall bars, this suggests that they are the most important systems for you. All of the bars might look similar, which will suggest that all your systems are involved. If you want to explore the senses further, you can follow these links. If you need further information from an occupational therapist, please contact us.